Mr. Chair. Minister, at present, 32% of Canadians have no dental insurance at all, and approximately 6 million Canadians avoid visiting the dentist every year due to cost. Canada's most vulnerable people have the highest rates of dental decay and disease, but the worst access to this much-needed health service exists among people with low income. So given these stark disparities, what steps is your government taking to ensure that all Canadians can access medically necessary dental care?
When we look at the Canada Health Act, Mr. Davies, we certainly recognize that the Canada Health Acts cover medically necessary services. With respect to dental care, we recognize that it's not covered under the Canada Health Act. I know that just recently I appeared at the Seniors Caucus Committee here, or our Seniors Caucus, and that was an issue that came up, an area that people wanted to look into. And I would actually encourage the committee to possibly even do some work in this area. But at this point in time, with respect to investments that we're making in that area, federally, no investments are being made.
Thank you. Now, on opioids, there's an overwhelming consensus among addictions professionals, community organizations, and families with lived experience that the leading cause of opioid deaths in Canada is the tainted street drug supply. It's plainly obvious that ensuring a safe supply would save lives. No less a figure than the president of the Canadian Medical Association is calling on Canadian politicians to have a, quote, open and courageous debate, end quote, on decriminalization. Yet you and the Prime Minister have explicitly ruled out any consideration of decriminalization and regulation. So my question is this: do you disagree with the stakeholder consensus, or is it simply a lack of political courage?
Mr. Davies, I think that you've heard me probably on several occasions that I certainly recognize that the opioid crisis is a devastating situation that's happening in our country at this point in time. And we certainly have to use all tools at our disposal in order to turn the tide on this crisis. With respect to the issue of decriminalization, I believe that decriminalization alone is not going to provide a safe supply of drugs on the streets, and many other experts in the field have said the same. Having met with individuals in Portugal as well, they've indicated that decriminalization alone is not the silver bullet solution in order to effectively turn the tide on this crisis. What I do, however, feel is having a safe supply of drugs is an option and a step in the right direction. That's why that regulatory changes have been made to ensure that medication replacement therapy is available. And we have ensured that diacetylmorphine, for example, we've gotten rid of some of the red tape that needs to take place for doctors to be able to prescribe it, and also the medication of methadone. So we continue to work with partners on the ground. We continue to use all the levers at our disposal to make sure that we effectively deal with this situation. But once again, I certainly recognize that more work needs to be done in this area, and we will continue to make the investments and to provide the support and leadership as the federal government.
Okay. Well, thank you. So, Minister, I mean, you've repeatedly claimed that your government is doing everything possible. You just said it again, using every lever to deal with the opioid crisis, but of course that's not true. Besides ruling out decriminalization, which is one lever that obviously would result in much more safe supply of drugs being accessible to Canadians, you refused to declare this a public health emergency under the Emergencies Act. We just heard this Tuesday, actually, from Sarah Blythe, who operates an overdose prevention site on Vancouver's downtown east side, the epicenter of the opioid crisis, that they received no federal money or a federal exemption to operate legally. And your government has failed to join BC's civil lawsuit against opioid manufacturers, just to name some. So we know that the U.S. federal government has secured criminal convictions and civil damages from opioid manufacturers for violating U.S. federal law. My question is simple. Has your ministry investigated criminal and civil violations of Canadian federal law? And if not, why not?
Well, you've asked 3 or 4 parts of your question there.
Just the last question is all I really want to know the answer to.
Well, with respect to addressing your question, though, with respect to declaring it a public health emergency, I just feel that I have to address that. If we felt that we had any more tools at our disposal by declaring this a public health emergency, we would absolutely do so. I've checked with my officials. I've checked with the Minister of Public Safety. By declaring it a public health emergency, it would give me no other levers to work with. And that is why that we haven't gone forward with declaring it a public health emergency. Again, with respect to decriminalization, Mr. Davies, decriminalization will not provide safe drugs on the streets to individuals. That alone is not going to be the end-all, fix-all. And with respect to the lawsuit in BC, as you've made reference to, our department is reviewing the class action or the lawsuit that's been filed by British Columbia, and no decision has been made at this time.
By the way, it's not just decriminalization, Minister, it's decriminalization and regulation of drugs to ensure that Canadians get a safe access to drugs. But I want to move, if I can, to forced sterilization. In 1986, the Supreme Court of Canada made the practice of forced or compulsory sterilization illegal in Canada, of course. And yet, more than 3 decades later, we are still confronting the stark reality that modern-day forced sterilizations are occurring in publicly funded, administered hospitals in Canada. 60 Indigenous women are currently engaged in a class action lawsuit alleging that they were subjected to forced sterilization in our healthcare system as late as 2017, last year. Now, we know that Amnesty International has confirmed this constitutes a form of torture as deformed by the UN, and we have a moral obligation to ensure that Canada's healthcare system upholds fundamental human rights. What actions are you taking as Federal Minister of Health to address this profoundly disturbing situation?
Thank you very much for your question. I have to agree with all of your comments, Mr. Davies. It's an appalling situation. It's completely unacceptable to think that this is happening in this country. It's certainly a clear violation of the human rights, and also it's a clear, it's gender-based violence. And here we are, December the 6th of all days, talking about this, a very appropriate, actually, day to be talking about this. It's just simply not acceptable at all. Myself and Minister Philpott work in close collaboration. We are reaching out to provinces and territories in order to further this discussion, and also not only provinces and territories, but also medical associations that really regulate these professions. We certainly want to make sure that we do all that we can to put an end to this. As I've indicated, I still can't even believe that in 2018 that we're having this conversation and it's happening in this country. So let me be clear, this is absolutely unacceptable, and we will do all that we can to ensure that this no longer occurs.
Now we go to Mr. Ayoub for 7 minutes.